Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
For the past few months, I've been dealing with severe stomach pain, especially after meals. I've also had consistent headaches, and my energy levels have been very low.
That sounds concerning. Do you have any other symptoms like nausea, vomiting, or changes in bowel habits?
Yes, nausea sometimes, but I haven't thrown up. And my bowel movements have been inconsistent, alternating between constipation and diarrhea.
Do you take any medications or supplements regularly?
Yes, I'm on omeprazole for acid reflux, and I occasionally take aspirin for headaches.
How long have you been on omeprazole?
About 6 months now.
Did you notice any improvement in your stomach issues after starting omeprazole?
Initially, yes, but the pain has worsened in the past 2 months.
That could indicate a more severe issue. Any history of gastrointestinal problems in your family?
My mother had ulcers in her late 40s, and my father had colon cancer.
Colon cancer in the family is significant. We'll need to check for that. Any other medical conditions or surgeries you've had?
I had a hernia repair surgery 5 years ago. No other major conditions.
Have you noticed any changes in your weight recently?
Yes, I've lost about 10 pounds in the past couple of months without really trying.
Are you having any trouble eating or maintaining your appetite?
My appetite has decreased due to the stomach pain. I've also had trouble sleeping because of the pain and frequent headaches.
How severe are the headaches?
They vary. Sometimes they're mild, but other times they can be really intense, making it hard to focus or do much.
Do you notice any triggers for your headaches?
Not specifically. They seem to come on randomly, though sometimes they seem worse after eating.
And your energy levels have been low for how long?
For about 3 months now. I often feel exhausted, even after a good night's sleep.
I see. Based on your symptoms and history, I believe we need to conduct a series of tests to understand the underlying causes. A colonoscopy is necessary given the family history of colon cancer, and an endoscopy would help assess the cause of your stomach pain. We should also run blood tests to check for infections, nutritional deficiencies, and to rule out anemia, which could explain the fatigue.
That makes sense. I'm ready to get some answers.
We'll also conduct a CT scan of your head to see if there's any underlying cause for your headaches. It might be connected to your gastrointestinal issues, but we want to rule out anything serious.
What about my diet? Should I be avoiding certain foods?
Until we get a clearer picture, it's best to avoid foods that tend to aggravate your symptoms. Stick to bland, easy-to-digest meals and avoid caffeine, alcohol, and spicy foods. Drink plenty of fluids to stay hydrated and maintain regular bowel movements.
Will do. What about the aspirin for my headaches?
Given your gastrointestinal issues, it's best to avoid aspirin for now. You can switch to acetaminophen, but avoid taking too much. We might need to adjust your medication regimen once we have a diagnosis.
Got it. I'll stick to acetaminophen.
Great. Let's get these tests scheduled as soon as possible. Once we have the results, we can tailor a treatment plan to address your conditions.
I appreciate that. I'll contact your office to arrange the appointments.
Perfect. We're here to support you through this. Please don't hesitate to reach out if your symptoms worsen before we meet again.
Thank you, doctor.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mr. Johnson. I see you've been experiencing significant health issues lately. Could you please describe what's been going on?
Good morning, doctor. Yes, it all started with some stomach pain, but now I'm also dealing with high blood pressure and constant back pain.
I'm sorry to hear that. Let's take it one step at a time. When did you first start experiencing stomach pain?
I think it was about 6 months ago. It would come and go, but recently it's become almost constant.
Has there been any change in your diet or lifestyle around that time?
Not really. I haven't changed much in terms of what I eat, but I have been under a lot more stress at work lately.
Stress can definitely have an impact on stomach issues. Have you noticed any changes in your bowel habits or any unexplained weight loss?
I have had some constipation recently, but I haven't lost any weight.
That's important to note. Moving on to the high blood pressure, when was that first diagnosed?
My doctor mentioned it during a routine checkup about 4 months ago. I was started on medication. I was put on lisinopril, but I'm not sure it's doing much to help.
It's possible that we may need to adjust the dosage or try a different medication. And what about your back pain? When did that start?
I've had back pain on and off for years, but in the past 3 months, it's become much worse.
Is the pain constant, or does it come and go?
It's mostly constant. There are some days when it's a bit better, but it's always there.
Does the pain radiate anywhere, like into your legs or buttocks?
No, it's just in my lower back.
Based on what you've told me, it sounds like we need to get a better understanding of what's happening in your body. For the stomach pain, we'll need to do some imaging studies, like an ultrasound or CT scan, to see if there's anything causing this persistent pain. Blood tests can also help us identify any inflammation or infection.
Okay, that sounds like a good place to start. What about my blood pressure?
I'll review your blood pressure logs to see how it's been fluctuating. If needed, we might switch your medication or add another one to better control it. I also recommend checking your kidney function, as high blood pressure can sometimes affect the kidneys and vice versa.
And what about my back?
For your back pain, We should do an X-ray to check for any structural issues. If nothing is found there, an MRI may be necessary to look for nerve or disc problems. Physical therapy might also help if it's muscular in nature.
So you think these issues could be related, or are they separate problems?
There might be some overlap. For example, high blood pressure can sometimes lead to kidney issues, which might explain some of the back pain. Stress can affect your stomach and blood pressure as well. We'll need to gather more data to see the full picture.
That makes sense. I'm feeling a bit overwhelmed, but I'm ready to find out what's going on.
It's completely understandable to feel that way. Let's start with the tests, and then we'll discuss the results together to make the best treatment plan for you.
Thank you, doctor. I appreciate your help.
It's my pleasure, Mr. Johnson. We'll work through this together and find the right solutions.